Good afternoon. My name is Alyssa, and I'm going to be your student nurse this afternoon. Can I please confirm your name and date of birth? Okay, great. And do you have any known allergies, including those to iodine or latex? Okay, wonderful. So I'm going to go ahead and raise your bed and explain why I'm here today. I'm here to insert a urinary catheter per your doctor's order. This is because you've been feeling some pressure in your abdomen and you've been having some trouble with urinary, like going to the restroom. And so I'm here to help relieve some of that by inserting a catheter. So I'm going to raise your bed to working height so I don't have to strain my back. I'm going to go a little bit higher to about the height of my hips. And I'm going to try to maximize your privacy and comfort as much as possible while I'm doing this. So I'm going to go ahead and bring down your sheets all the way to the foot of your bed. And I am going to place this waterproof pad underneath you. I'm first going to put on clean gloves to do this. And this is just so we can make sure that nothing gets on your bed or underneath you that is wet during this process. So, I'm going to raise your gown just a little bit so it's not caught underneath you. And if you could please raise your hips for me, I'm going to put this this waterproof pad underneath you. And in reality, the patient would be able to assist. Okay, so the waterproof pad is in place. So now I'm going to clean your perineal area. So I'm going to expose your genital area, Mr. Button. And I'm going to use this bathing cloth wipe to clean your area and assess for any signs of infection. And I'm also going to move the trash can over. And I would move that with my foot, not with my hand. Okay, so I'm going to and I'm going to lower this side rail because it is in my way. Okay, Mr. Button, I'm going to touch you now. One swipe. Another swipe. And then one more swipe. And then I will dispose of the wipe. And I am assessing for signs of infection, and I do not see any. And so now I'm going to clean or dry the perineal area. Okay, and then I would dispose of the towel properly in the waste or the laundry basket. And now I'm going to remove my gloves and perform hand hygiene.
But I would do that right before.
And I would have spread your legs, or I'm going to go ahead and spread your legs. But I'm going to go ahead and place the catheter kit in between your legs and make sure my trash can is in a good place for me to work. And I'm going to make sure I'm staying within a 1-inch margin of the kit. Okay, and now I'm going to put on my sterile gloves, and I can touch this and dispose of it properly. So now I'm going to put on my sterile gloves.
Wait, you measure it twice? So you measure in the back?
No, you don't have to.
And then put on my other sterile glove.
I mean, there's not going to be any liquids when you check out anyway, so you're just pretending.
Okay. And then I can adjust this one again. Okay, now I have sterile gloves on. Now I'm going to grab the waterproof drape and place it under Mr. Button to make sure, in case anything leaks as I'm inserting the catheter, that we have a waterproof pad underneath. And I'm going to make sure this does not touch anywhere on my body except my gloves. And I think I'm holding this now. Oh my god. Okay. I'm going to set this side down. Okay. And then I'm going to take the drape and drape it over Mr. Button's perineal area. Okay. So now I'm going to remove this tray. I'm going to scoot this box back just a little bit, and I'm going to remove the tray, move it forward, and I'm going to remove the plastic from the tubing and remove and throw it in the trash. And then I'm going to attach, I won't actually do it now because it's not going to stay, but I would remove this cap and attach it to the port on the catheter, but it won't stay, but I would do that. And then I'm going to open the lubricant and squirt it onto the tray and throw away that one in the trash. And then I'm going to open the betadine swabs, set them down, and also throw in the trash without lowering my hands. And then now I'm going to grab Mr. Button's penis. Okay, Mr. Button, I'm going to touch you now. Okay, so I'm going to clean your penis before I insert the catheter. So I would grab one swab and swipe around the glands, drop. Grab another, swipe again, drop. And grab another, swipe again, drop. Okay, so now with the syringe attached, I'm going to go ahead and insert the catheter, and I'm first going to dip it into the lubricant. And now, Mr. Button, I'm preparing to insert the catheter. You're going to feel a little bit of pressure, so if you could please take a deep breath for me. And 1, 2, 3. Okay, and it would probably go further, but since I'm feeling resistance, I'm going to stop. And so I would grab it, and it would stay, or no, it wouldn't stay. So I'm going to grab it, and then the syringe would be attached. So I would insert it and insert the 10 milliliters of saline, and then I would let go and pull a little bit until I would feel resistance again. And then I'm finished with that entire process, so I'll remove my gloves. And then I would throw those away, and then I'm going to take the bag, and first I need a tape. Yes, I need to tape the tubing to the patient's leg. I should have gotten a longer piece of tape. And knowing that this would be further in, it would probably be able to be placed better. But I would tape it to the patient's leg, and then I will move the bag to the side of the bed, and I will make sure that the bag is attached to the bed and not the side rail. And then I'm going to clean up the area and dispose of everything properly. And then I will cover the patient, perform hand hygiene. I don't know if this is a false one. But then raise the side rail, recover the patient.
Just after you measure it, you come back and take your blood off.
Okay, that wouldn't be happening because it'd be further in the patient.
Order won't be
Mr. Button, do you have any pain? Okay, and your urine will flow out of the catheter, so that's how you will use the restroom. You have your personal belongings and your call light, your pumps, and everything look good to me. And are you in a comfortable position? I know. Wonderful. Okay, so I'm going to go ahead and lower the bed, and if you need anything at all, please call and let me know. Good afternoon, Mr. Button. It's me, Alyssa, again, and good news, I'm here to take out your urinary catheter. So, could you please confirm your name and date of birth for me? Wonderful. And do you have any known allergies? Okay, great. So I'm going to go ahead and raise your bed, and according to your chart and your doctor's orders, I've been instructed to remove your urinary catheter, which is great news. So you might not feel as uncomfortable anymore, and it might be a little uncomfortable removing it, but I'm going to go as quickly and stress-free as possible. So I'm going to raise your bed to a working height so it's comfortable for me to be at. Just take a second. Are you doing okay today? Okay, wonderful. So it's at a good height, and I'm going to pull your sheets down to the foot of your bed. I'm going to spread your feet apart a little bit, and you already have a waterproof pad underneath you, so I do not need to add another one. So I'm going to expose you just a little bit, and I'm going to put on clean gloves.
Have you ever had a patient lock herself in the bathroom so she can use her own ID to do that?
Okay, so I have my clean gloves on, and I'm going to empty the bag. So I'm going to use this canister, and I'm going to empty the urine. Okay. And the patient voided approximately 400 cc, so I go to the restroom, pour it into the toilet, flush, and leave it in the bathroom. And so now I'm gonna remove the bag and set it up here. And now I'm going to take the syringe and attach it to the port. This would still be properly taped on with good tape. And remove the cap and deflate the balloon. And so it would be deflated, and I'd remove the tape, and then I would inform the patient. And so now, Mr. Button, I'm going to remove your catheter. So if you could take a deep breath for me, 1, 2, 3, and let that land on the waterproof pad. And then I would take all the supplies and dispose of them properly in the biohazard. And then I would recover the patient, remove my gloves, perform hand hygiene, recover the patient, and lower the bed while performing IV. So, are you in any pain right now? Okay, wonderful. Are you in a comfortable position? Okay, do you need to go to the restroom? Okay, so when you do need to go, please call us so we can evaluate that first void. All your pumps are good, and you have your personal belongings and your call light. And again, please make sure to call us for your first void.